Fruits seniors should limit to reduce the risk of stroke. As we age, our bodies become more sensitive to sugar, acidic compounds, and substances that can trigger inflammation or affect blood pressure and heart health. While fruits are generally healthy, some can pose hidden risks, especially for older adults if consumed excessively or improperly. These risks include elevated blood pressure, arterial plaque buildup, and ultimately a higher risk of stroke. Here are 8 fruits that seniors should consider limiting in their daily diet. 1. Overripe bananas, a sweet treat that may raise blood pressure in seniors. With their sweet taste, soft texture, and easy digestibility, ripe bananas are often seen as a go-to snack for older adults. However, few realize that this seemingly harmless fruit can be problematic, especially for seniors with high blood pressure, heart disease, or kidney issues. 1. Rich in potassium, but can backfire in older adults. Bananas are a great natural source of potassium, an essential mineral that helps regulate heart rhythm and supports muscle and nerve function. However, when bananas become overripe, their natural sugars, glucose and fructose, spike, and the potassium content becomes more concentrated as starches break down into sugars. In elderly individuals, kidney function typically declines over time, making it harder for the body to excrete excess potassium. Consuming too many overripe bananas can lead to a condition called hyperkalemia, high potassium in the blood, which may cause irregular heartbeats, chest pain, and in severe cases, cardiac arrest. Hashna 2. Risk of raising blood sugar. Overripe bananas have a higher glycemic index, GI, compared to green or slightly underripe bananas. For seniors with diabetes or prediabetes, eating these bananas can cause blood sugar spikes, complicating disease management and increasing the risk of cardiovascular complications or stroke. 3. How to eat bananas safely. Avoid eating overly ripe bananas with lots of black spots on the peel. This indicates high sugar content. Limit intake to half or 1 banana per day, depending on individual health and activity level. Seniors with kidney problems, high blood pressure, or those taking diuretics should consult a doctor before including bananas in their diet. Combine bananas with high fiber or protein-rich foods like plain yogurt or oatmeal to slow down sugar absorption. Conclusion. Bananas are nutritious, but when overripe, they can pose surprising risks for older adults. To prevent stroke and maintain optimal health, it's important to monitor banana consumption, avoid overly ripe ones, and pair them wisely with other foods. 2. Watermelon, a summer refreshment that may overheat senior blood pressure. On hot days, a juicy slice of watermelon seems like the perfect way to stay cool. However, for older adults, overindulging in watermelon can lead to serious health concerns, particularly concerning blood pressure and heart function, both of which directly impact stroke risk. SPA 1. High in natural sugar can spike blood glucose. While watermelon is low in calories, it contains a significant amount of natural sugars, especially fructose and glucose. Just 150 grams of watermelon, about 1 small slice, contains over 17 grams of sugar. For seniors with diabetes or glucose metabolism disorders, eating too much watermelon can cause rapid spikes in blood sugar, leading to fatigue, dizziness, and, if sustained, damage to brain and blood vessels. Moreover, watermelon has a high glycemic index, around 72, meaning it's quickly absorbed into the bloodstream, causing sharp fluctuations in blood sugar. These fluctuations strain the heart and increase the likelihood of stroke. 2. May cause electrolyte imbalance if overconsumed. Watermelon is made up of about 90% water. While hydrating, excessive consumption, especially in a short period, can lead to frequent urination and mineral loss. This imbalance in electrolytes can result in dizziness, irregular heartbeat, and even fainting. For seniors with a history of heart disease or high blood pressure, losing too much potassium or sodium may elevate the risk of sudden stroke or acute heart failure. 3. Tips for eating watermelon wisely. Eat watermelon in the morning or early afternoon. Avoid eating it at night to prevent nocturia, frequent nighttime urination that disrupts sleep. Limit portions to 100 to 150 grams, 1 to 2 small slices, and avoid daily consumption over extended periods. Avoid eating cold watermelon straight from the fridge, especially for seniors with stomach or heart conditions, or those taking diuretics. Diabetic patients should closely monitor their blood sugar after eating watermelon. Conclusion: watermelon is a delightful gift of summer, but for seniors, its benefits depend entirely on how it's consumed. Overeating or eating at the wrong time can increase the risk of blood sugar issues, electrolyte imbalance, and ultimately stroke. Eat watermelon mindfully and moderately to preserve heart and brain health in the long run. Grapes, a sweet fruit that can burst blood vessels in seniors if consumed excessively. Grapes have long been a favorite fruit thanks to their sweet, pleasant taste and ease of eating. However, for older adults, grapes may pose serious health risks if consumed excessively or frequently, especially for those with underlying conditions such as high blood pressure, diabetes, or mild kidney dysfunction, which are all factors that increase the risk of stroke. 1. High sugar content, the silent disruptor of blood sugar levels. Although grapes are a natural fruit, they contain a relatively high amount of natural sugars. Just a small bunch, about 150 grams, can contain over 20 grams of sugar, equivalent to a small can of soda. For older adults with metabolic disorders or prediabetes, this amount of sugar can cause a sudden spike in blood glucose, leading to vascular damage, elevated blood pressure, and stress on cerebral blood vessels, factors that heighten the risk of stroke. 2. High in potassium. Beneficial for the healthy, risky for those with kidney issues. Grapes also contain a relatively high amount of potassium. While potassium helps regulate blood pressure in healthy individuals, older adults with declining kidney function may struggle to excrete excess potassium. This can lead to hyperkalemia, a condition that disrupts heart rhythm, causes fatigue, and in severe cases may result in cardiac arrest or stroke due to uncontrolled cardiovascular function. 3. Potential pesticide and preservative residues. Grapes are frequently listed among the dirty dozen, the 12 fruits and vegetables most likely to contain pesticide residues. If not thoroughly washed, these chemicals can accumulate over time, impacting the liver, kidneys, and central nervous system, which are already weakened in older adults. Tips for consuming grapes for seniors. Limit intake to 100 to 150 grams per serving, about 10 to 15 small grapes. Avoid eating on an empty stomach or right after meals high in starch or sugar. Always wash thoroughly. Soaking in salt water or diluted vinegar is recommended to remove chemicals. Seniors taking diuretics or cardiovascular medications should consult their doctor before regular consumption. Conclusion: grapes are sweet, soft, and tasty, but for seniors, this is not a fruit to eat carelessly. Consume in moderation and mindfully, because the heart, kidneys, and especially brain blood vessels need more protection than ever. When grapes become a double-edged sword, the wise choice is to eat less, eat right, and listen to your body every day. Watermelon, a refreshing summer fruit that may not be gentle on senior health. On hot days, nothing feels better than a refreshing slice of watermelon. However, for older adults, especially those with a history of high blood pressure, diabetes, or heart disease, this seemingly innocent fruit may actually pose risks to blood vessels and brain health if consumed improperly. 1. High natural sugar content causes unstable blood glucose levels. Watermelon has a relatively high glycemic index, GI, around 72 to 80, meaning it can cause rapid spikes in blood sugar. For seniors with weakened pancreatic function, this can lead to sudden glucose surges, causing fatigue, dizziness, and over time, atherosclerosis, a common cause of strokes. Moreover, many people eat watermelon at night or after heavy meals, which leads to sugar and water accumulating in the stomach, not only causing bloating, but also affecting sleep quality and putting extra strain on the heart and blood vessels. 2. High water content but low in fiber may cause mild digestive issues. Watermelon contains up to 92% water, which helps cool the body but offers very little fiber. For elderly individuals with weaker digestive systems, this can lead to loose stools or mild diarrhea, resulting in electrolyte imbalance, heart rhythm disturbances, and even blood pressure drops, especially dangerous for those taking heart or blood pressure medications. 3. Potential preservative chemical residues, harmful to the liver and kidneys. Some commercial watermelons may be artificially ripened or made visually appealing with chemical agents. Additionally, preservatives may be used for longer storage. For seniors whose liver and kidney functions are already compromised, These chemicals can build up in the bloodstream, adversely affecting blood pressure and the central nervous system, increasing the risk of strokes. Advice for seniors when eating watermelon. Limit intake to 150 to 200 grams per serving and eat only 1 to 2 times per week. Avoid cold watermelon as it may cause blood vessel constriction, especially in those with heart conditions. Do not eat overly ripe watermelon or those left out in the open for too long, as they may harbor bacteria. Choose organic or clearly sourced watermelon and avoid unnaturally bright varieties. Conclusion: watermelon is refreshing and tasty, but not suitable for frequent or excessive consumption by older adults. Remember, today's moment of delight shouldn't come at the expense of tomorrow's health. Portion control and body awareness are key for enjoying watermelon without compromising vascular health. Here's the English translation of your text. Raisins, a sweet snack, but full of risks for the elderly. Raisins have long been loved by many for their sweet taste, ease of consumption, and convenience. However, few realize that a small handful of raisins, which may seem harmless, can carry hidden risks for the health of older adults, especially in terms of stroke risk, high blood pressure, and blood sugar control. 1. Concentrated sugar content. The enemy of blood vessels. When fresh grapes are dried, most of the water is removed, but the natural sugar, fructose, remains. This results in a significantly higher glycemic index, GI, for raisins compared to fresh grapes. Older adults often experience a decline in their ability to metabolize sugar, so consuming raisins can easily lead to a spike in blood sugar, putting pressure on the blood vessel walls and increasing the risk of arteriosclerosis, a leading cause of stroke. Just 2 tablespoons of raisins, approximately 30 grams, contains nearly 20 grams of sugar, equivalent to about 5 teaspoons of white sugar. If consumed frequently throughout the day without proper control, this accumulated sugar can cause significant harm to the nervous and cardiovascular systems of older adults. 2. Risk of sulfur residue, a silent poison. To maintain their appearance and prevent mold, many types of raisins on the market are treated with sulfur dioxide, SO2, a preservative that can irritate the lungs, cause respiratory failure, and increase liver toxicity if accumulated over time. For older adults with weakened liver and kidney function, these chemicals become even more dangerous. Some studies have shown that prolonged exposure to or consumption of foods containing sulfur dioxide can cause metabolic disorders, affect blood pressure, and impair brain circulation, thus increasing the risk of stroke in older adults. 3. Not suitable for those on cardiovascular medication. Raisins are high in potassium, which is beneficial for healthy individuals. However, for older adults who are taking ACE inhibitors or potassium-sparing diuretics, regular consumption of raisins can lead to hyperkalemia, which may result in arrhythmia and affect blood pressure. Safe suggestions for older adults. If you enjoy raisins, limit your intake to 5 to 7 pieces at a time and avoid consuming them daily. Opt for organic raisins, free from additives and with clear sourcing information. Consider replacing raisins with fresh grapes in moderation to provide antioxidants while better controlling sugar intake. Summary: raisins can be a delicious and convenient snack, but they also carry hidden risks for older adults. Overconsumption or lack of awareness can silently lead to blood vessel, blood pressure, and cardiovascular problems, which increase the risk of stroke. Use raisins cautiously and in moderation. That's the key to long-term health protection. Watermelon, a refreshing fruit, but full of risks for the elderly. On hot summer days, watermelon is a great choice for cooling off, hydrating, and providing a refreshing feeling. With its sweet taste, high water content, and easy digestibility, watermelon has long been a favorite food for many, including older adults. However, hidden behind its seemingly innocent sweetness are health risks that the elderly need to be particularly aware of, especially when related to blood pressure, heart health, and the risk of stroke. 1. High natural sugar content, a danger for those with metabolic issues. Watermelon contains a large amount of natural sugar, fructose, and has a high glycemic index, GI, meaning that blood sugar levels can spike rapidly after consumption. For younger individuals, this may not be a serious issue. However, for older adults, who often have impaired metabolic function and are more prone to diabetes or prediabetes, this can lead to severe complications. When blood sugar rises suddenly after consuming watermelon, the body releases insulin to restore balance. However, if this occurs repeatedly, the pancreas can weaken, leading to chronic high blood sugar, which damages blood vessel walls, contributes to arteriosclerosis, one of the primary causes of stroke and heart attacks. 2. Can lower blood pressure in those with low blood pressure. Watermelon contains citrulline, an amino acid that helps dilate blood vessels, improve blood circulation, and may lower blood pressure. While this can be beneficial for those with high blood pressure, for older adults with low blood pressure, or those who experience sudden drops in blood pressure, eating too much watermelon can lead to dizziness, imbalance, and a sudden risk of falling, a contributing factor that indirectly increases the risk of stroke. Particularly in the morning or after bathing, blood pressure tends to be lower than usual. If watermelon is consumed during these times, older adults may experience reduced blood flow to the brain, dizziness, blurred vision, or even fainting. 3. Risk of digestive tract coldness. Watermelon is a cold-natured fruit. Eating too much, especially when stored in the refrigerator, can lead to stomach discomfort, abdominal pain, diarrhea, or digestive disturbances in older adults, whose digestive systems are more sensitive and weakened with age. Safe suggestions. Only eat watermelon during the daytime when the body is more active. Avoid eating it straight from the fridge or on an empty stomach. For those with diabetes, limit intake to 1 to 2 small slices after a main meal and closely monitor blood sugar levels post-consumption. Conclusion. Watermelon is good for health if consumed properly, but for older adults, overeating or consuming it at the wrong time can lead to dangerous consequences, such as blood pressure imbalances, elevated blood sugar, and digestive instability. Therefore, eat watermelon in moderation, intelligently, and monitor your body's response, especially if you have underlying conditions like diabetes or low blood pressure. Let me know if you need any adjustments. Here's the English translation of your text. Lychee, the sweet summer fruit with stroke risks for the elderly. Every summer, lychee becomes a beloved fruit for many, thanks to its rich sweetness, distinctive fragrance, and refreshing, juicy texture. With its eye-catching appearance and irresistible taste, lychee often appears in dessert servings in Vietnamese households, including those with elderly family members. However, behind its sweetness lies a series of health risks that older adults should be particularly cautious about, especially those with cardiovascular problems, high blood pressure, and metabolic issues. High sugar content, a hidden culprit for sudden blood sugar spikes. Lychee belongs to the group of fruits with extremely high natural sugar content, an average of 15 grams of sugar per 100 grams of lychee. This gives lychee a high glycemic index, GI, causing blood sugar levels to rise quickly after consumption. For older adults, especially those dealing with diabetes or metabolic disorders, eating too much lychee can result in dangerous blood sugar fluctuations, potentially leading to a diabetic coma if not controlled in time. What's particularly dangerous is eating lychee on an empty stomach. The body is more prone to metabolic disturbances in glucose, leading to reactive hypoglycemia, which causes dizziness, trembling, sweating, unconsciousness, and could even trigger a stroke. 2. Negative effects on the cardiovascular system. The high sugar content not only affects blood sugar levels, but also promotes atherosclerosis, increases blood fat levels, and impacts heart function. For older adults whose blood vessels have already aged and become less elastic, consuming too many lychees can cause the heart to overwork to pump blood, leading to a high risk of hypertension and stroke. Moreover, lychee has a warming property. Overconsumption can lead to skin rashes, mouth sores, nosebleeds, and insomnia, all symptoms that older adults find particularly uncomfortable. Safe lychee consumption for older adults. Limit consumption to 3 to 5 lychees per serving and avoid eating on an empty stomach. Do not consume lychee late at night, as it may affect sleep and increase blood sugar at night. Consider pairing lychee with a few slices of cucumber or drinking water to balance its effects. Conclusion. Lychee is delicious and nutritious when eaten properly, but for older adults, consuming too much or eating it at the wrong time can lead to imbalanced blood sugar and put excessive strain on the cardiovascular system, thus increasing stroke risk. So, don't let the sweetness fool you. Manage lychee intake wisely and carefully. Mangosteen, a favorite fruit, but a potential risk for the elderly. Mangosteen is a familiar fruit in the summer, known for its sweet, mild tang and distinctive fragrance. This fruit can be considered a savior for those who enjoy refreshing and unique flavors. However, for older adults, mangosteen can be a fruit that requires caution due to its potential effects on health, especially when it comes to cardiovascular issues and blood pressure. 1. High sugar content, a hidden risk for diabetes. Mangosteen has a relatively high sugar content, an average of 14 to 16 grams of sugar per 100 grams of mangosteen, which means it has a high glycemic index, GI. For older adults, eating too much mangosteen can cause a rapid increase in blood sugar levels, which can lead to diabetes if consumed regularly without proper control. Furthermore, this sudden change in blood sugar can make older adults feel dizzy, fatigued, or in severe cases, cause serious complications such as a diabetic coma or stroke. Specifically, those undergoing diabetes treatment need to carefully manage blood sugar levels and avoid eating mangosteen when their blood sugar is high. 2. The warming property of mangosteen, a risk for those with high blood pressure. Although mangosteen is loved by many for its sweetness and refreshing properties, in traditional Chinese medicine, mangosteen is considered a warming fruit. This can increase internal body heat and raise blood pressure, particularly for older adults with pre-existing high blood pressure. When blood pressure spikes suddenly, older adults are at a higher risk of serious issues like stroke, brain hemorrhage, or heart attacks. Therefore, older adults with high blood pressure or those in the pre-hypertension stage should limit their mangosteen intake, especially when the body is already under stress or fatigue. Tips for eating mangosteen safely. Limit consumption to 2 to 3 pieces per serving and avoid eating too many at once. Do not eat mangosteen late in the evening to avoid disrupting sleep and digestion. Pair mangosteen with cooling fruits, such as cucumber or oranges, to balance the body. Conclusion: mangosteen, while delicious and nutritious, is not an ideal choice for older adults if not properly controlled. Its high sugar content and warming nature can cause fluctuations in the body, especially in those with cardiovascular, blood pressure, or diabetes issues. Therefore, eating mangosteen requires careful consideration and adjustment to protect the health of the elderly. Recommendation: to protect cardiovascular health and reduce the risk of stroke, older adults should be cautious in choosing fruits. Some fruits, though delicious, contain high levels of sugar that can negatively impact blood pressure and blood sugar levels. Focus on consuming fresh, low-sugar, and fiber-rich fruits like apples, oranges, and cucumbers. Don't forget to combine a healthy diet with light exercise and regular health checkups to ensure the body stays in optimal condition. Making smart food choices is an important step to maintaining long-term health and avoiding dangerous complications. Let me know if you need any further adjustments.